CEN Certification. Question 1. A patient with an asthma exacerbation has a peak expiratory flow rate, PEFR, of 40% of predicted. Breath sounds are quiet, and the patient is using accessory muscles. The CEN should recognize this as Option A, mild exacerbation. Option B, moderate exacerbation. Option C, severe exacerbation. Option D, life-threatening asthma with impending respiratory failure. The correct answer is option C, severe exacerbation. A PEFR of 40 to 50% of predicted indicates a severe asthma exacerbation. Signs include dyspnea at rest, use of accessory muscles, and quiet breath sounds. Treatment includes continuous nebulized beta agonists, ipratropium, systemic steroids, and consider magnesium sulfate. A PEFR 33%, confusion, or a silent chest indicates life-threatening asthma, which may require intubation. Question 2. Which of the following is a clinical feature of a pulmonary contusion? Option A, hemoptysis. Option B, chest wall crepitus. Option C, subcutaneous emphysema. Option D, unilateral wheezing. The correct answer is option A, hemoptysis. Pulmonary contusion, bruising of lung tissue, often results from blunt chest trauma. Clinical features include hemoptysis, hypoxia, and opacities on chest X-ray that develop over 24 to 48 hours. Chest wall crepitus and subcutaneous emphysema suggest pneumothorax or rib fracture. Unilateral wheezing suggests a foreign body or bronchial obstruction. Treatment is supportive with oxygen and pain control. Question 3. A patient with a head injury has a GCS of 8. The CEN should: Option A, intubate the patient. Option B, elevate the head of the bed to 30 degrees. Option C, administer mannitol. Option D, all of the above. The correct answer is option D, all of the above. A GCS8 indicates severe head injury and a need for airway protection and management of elevated ICP. Intubation is indicated to protect the airway and manage ventilation. Head elevation to 30 degrees reduces ICP. Mannitol or hypertonic saline is used to reduce ICP. All interventions are indicated in severe head injury. Question 4. A patient is suspected of being a victim of human trafficking. The CEN should: Option A, notify security and social work. Option B, notify law enforcement. Option C, provide a private space for assessment. Option D, all of the above. The correct answer is option D, all of the above. Human trafficking is a serious crime. The CEN should recognize signs and screen patients for trafficking. The patient should be assessed in a private space away from their companion, who may be the trafficker. Security and social work should be notified. Law enforcement should be notified if there is suspicion. The patient's safety and privacy are essential. Question 5. A patient presents with chest pain, shortness of breath, and pleuritic pain. Vital signs: HR 110, RR 24, SpO2 88% on room air. The patient recently had knee surgery. Which diagnosis is most likely? Option A, myocardial infarction. Option B, pulmonary embolism. Option C, pneumothorax. Option D, pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors for VTE, recent surgery, immobility, and presents with the classic triad of dyspnea, chest pain, and hypoxia. Pulmonary embolism, PE, should be suspected. Wells criteria and PERC rule can help stratify risk. CTA is the diagnostic test of choice. Anticoagulation should be initiated promptly if PE is confirmed or strongly suspected. Question 6. Which condition is characterized by paradoxical chest wall movement during inspiration, flail chest? Option A, pneumothorax. Option B, pulmonary contusion. Option C, multiple rib fractures with a segment floating independently. Option D, cardiac contusion. The correct answer is option C. Multiple rib fractures with a segment floating independently. Flail chest occurs when 3 or more adjacent ribs are fractured in 2 or more places, creating a freely moving segment. This segment moves paradoxically, inward during inspiration, outward during expiration, impairing ventilation. Pain control, oxygen, and possibly mechanical ventilation are mainstays of treatment. Question 7. A patient presents with sudden onset of severe, sharp, lower abdominal pain radiating to the flank, nausea, and hematuria. Which diagnosis is most likely? Option A, appendicitis. Option B, renal calculi. Option C, ovarian torsion. Option D, diverticulitis. The correct answer is option B. Renal calculi. Renal calculi, kidney stones, present with sudden, severe flank pain, renal colic, radiating to the groin, nausea, vomiting, and hematuria. CT scan without contrast is the diagnostic test of choice. Pain control, 4 opioids or NSAIDs, and fluids are the mainstays of treatment. Ovarian torsion presents with adnexal pain and should be considered in female patients. Question 8. A patient with adrenal crisis, Addisonian crisis, presents with hypotension, hyponatremia, hyperkalemia, and nausea. The CEN should anticipate. Option A, 4-hydrocortisone. Option B, 4-normal saline. Option C, 4-dextrose. Option D. All of the above. The correct answer is option D. All of the above. Adrenal crisis is a medical emergency requiring 4-hydrocortisone, 4-normal saline, 4-hypotension, and 4-dextrose if hypoglycemic. Signs include hypotension refractory to fluids, nausea, vomiting, hyponatremia, hyperkalemia, and hypoglycemia. Prompt treatment prevents circulatory collapse. Hydrocortisone should be given before the patient is transferred to the ICU. Question 9. A patient presents with heat stroke, temperature 40.5 degrees Celsius, 105 degrees Fahrenheit, confusion, and hot, dry skin. The priority intervention is Option A, 4 fluids. Option B, cooling measures, ice packs, cold water immersion. Option C, antipyretics, acetaminophen. Option D, neurological assessment. The correct answer is option B. Cooling measures, ice packs, cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. The priority is to lower the core temperature as quickly as possible using ice packs, cold water immersion, or evaporative cooling. Antipyretics are ineffective in heat stroke because the pathophysiology is not hypothalamic. Cooling should be done until the core temperature reaches 38.9 degrees Celsius, 102 degrees Fahrenheit. 4 fluids are supportive. Question 10. A patient presents with sudden, severe, and sharp pain in the right lower quadrant, nausea, and vomiting. Rebound tenderness is present. The CEN should suspect Option A, pancreatitis. Option B, appendicitis. Option C, diverticulitis. Option D, ovarian cyst. The correct answer is option B. Appendicitis. Appendicitis typically presents with periumbilical pain that migrates to the right lower quadrant, McBurney's point, anorexia, nausea, vomiting, and fever. Rebound tenderness and guarding suggest peritoneal irritation. CT scan with contrast is the diagnostic test of choice. Surgical consultation is needed promptly to prevent perforation. Question 11. A 55-year-old male presents with chest pain radiating to the jaw, diaphoresis, and nausea. The 12-lead ECG shows ST segment elevation in leads V1 V4. Which intervention is the priority? Option A, administer morphine 4 mg 4. Option B. Administer aspirin 324 mg chewed. Option C. Prepare for emergent percutaneous coronary intervention, PCI. Option D. Obtain a chest X-ray. The correct answer is option C. Prepare for emergent percutaneous coronary intervention, PCI. This patient is experiencing an ST segment elevation myocardial infarction, STEMI, indicated by ST elevation in anterior leads V1 V4. The priority is rapid reperfusion. The goal is door-to-balloon time of 90 minutes or less for PCI. While aspirin and morphine are important adjuncts, they do not address the underlying occlusion. Chest X-ray is not the priority. Door-to-needle for fibrinolysis is 30 minutes if PCI is not available. Question 12. A patient with a psychiatric emergency is placed on a legal hold, e.g., 5150. The CEN should: Option A. Allow the patient to leave if they are calm. Option B. Inform the patient they are on a legal hold and document. Option C. Call the police to discharge the patient. Option D. Ignore the legal hold. The correct answer is option B. Inform the patient they are on a legal hold and document. Patients on a legal hold, involuntary psychiatric hold, are not allowed to leave until they are evaluated. The CEN should inform the patient of the hold and document the process. The patient must be kept safe and in a monitored environment. The hold is a legal order, and leaving would be against the law. The CEN should not discharge the patient. Question 13. Which of the following is a classic finding in a patient with pericarditis? Option A. ST segment elevation in all leads. Option B. PR segment depression. Option C. Chest pain that worsens with inspiration. Option D. All of the above. The correct answer is option D. All of the above. Pericarditis presents with diffuse ST segment elevation, often concave upward, PR segment depression, and chest pain that is pleuritic, worse with inspiration, and better leaning forward. It is often viral in origin. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 14. Which ECG finding is most concerning for a patient with a heart rate of 220 beats per minute and a blood pressure of 80/50 mmHg? Option A. Atrial fibrillation with rapid ventricular response. Option B. Supraventricular tachycardia, SVT. Option C. Ventricular tachycardia with a pulse. Option D. Atrial flutter with 2:1 block. The correct answer is option C. Ventricular tachycardia with a pulse. Ventricular tachycardia with a pulse and signs of instability, hypotension, heart rate 200, requires immediate synchronized cardioversion. Unstable patients with tachyarrhythmias should be cardioverted promptly. Waiting for pharmacologic therapy in an unstable patient can be fatal. The other rhythms may also require treatment but are less immediately life-threatening in this scenario. Question 15. A patient with SVT has failed vagal maneuvers. The CEN should prepare to administer. Option A. Adenosine 6 mg 4 push. Option B. Atropine 1 mg 4. Option C. Epinephrine 1 mg 4. Option D. Amiodarone 300 mg 4. The correct answer is option A. Adenosine 6 mg 4 push. Adenosine is first line for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. Atropine is for bradycardia. Epinephrine is for cardiac arrest. Amiodarone is for ventricular arrhythmias. Adenosine works by transiently blocking AV node conduction. Question 16. A patient presents with a near-drowning event. The CEN should be aware of which complication? Option A. Aspiration pneumonia. Option B. Pulmonary edema. Option C. Hypoxia. Option D. All of the above. The correct answer is option D. All of the above. Near drowning can lead to aspiration pneumonia, pulmonary edema, and severe hypoxia, which may progress to ARDS. The priority is airway management, oxygen, and treating any underlying causes, e.g., cervical spine injury. The patient should be monitored for respiratory distress, electrolyte abnormalities, and neurologic injury. All of these complications are possible and require monitoring. Question 17. A patient with a history of COPD is being discharged. The CEN should provide education on Option A, smoking cessation. Option B, use of bronchodilators. Option C, the importance of pulmonary rehab. Option D, all of the above. The correct answer is option D, all of the above. Patient education is a key part of CEN practice. COPD discharge teaching includes smoking cessation, correct use of bronchodilators, pulmonary rehabilitation, and monitoring for signs of infection. This is part of professional nursing responsibility. Question 18. A patient with subarachnoid hemorrhage presents with a sudden thunderclap headache, nuchal rigidity, and photophobia. Which diagnostic test is the initial gold standard? Option A, non-contrast CT head. Option B, lumbar puncture. Option C, MRI brain. Option D, CT angiography. The correct answer is option A, non-contrast CT head. Non-contrast CT head is the initial test for suspected subarachnoid hemorrhage, SAH. It has a sensitivity of 90 to 95% within 24 hours of onset. If the CT is negative but clinical suspicion remains high, a lumbar puncture is needed to detect xanthochromia, indicating breakdown of red blood cells in the CSF. CTA may be done to identify the source of bleeding, but CT is the initial diagnostic test. Question 19. What is the most common dysrhythmia associated with acute myocardial infarction? Option A, atrial fibrillation. Option B, ventricular tachycardia. Option C, ventricular fibrillation. Option D, premature ventricular contractions, PVCs. The correct answer is option D, premature ventricular contractions, PVCs. PVCs are the most common dysrhythmia seen in acute MI, often indicating myocardial irritability. While ventricular tachycardia and ventricular fibrillation are more dangerous, PVCs are more frequent. Atrial fibrillation can also occur but is less common. Reperfusion therapy and antiarrhythmic management are key strategies. Question 20. A patient with a dog bite wound presents with redness, swelling, and purulent drainage. The CEN should: Option A, irrigate the wound and prescribe antibiotics. Option B, culture the wound and start empirical antibiotics. Option C, close the wound primarily. Option D, apply a pressure dressing. The correct answer is option B, culture the wound and start empirical antibiotics. Infected wounds, cellulitis, abscess, require cultures and antibiotics. Dog bites can be infected with Pasteurella, Capnocytophaga, and other organisms. Empirical antibiotics, amoxicillin clavulinate, are often started. The wound should be opened, drained, irrigated, and debrided. Primary closure is generally not recommended for infected wounds, they are left open for drainage. Question 21. Which medication is used to manage postpartum hemorrhage? Option A, oxytocin. Option B, misoprostol. Option C, tranexamic acid. Option D, all of the above. The correct answer is option D, all of the above. Postpartum hemorrhage, PPH, is managed with uterotonics. Oxytocin is the first-line agent, misoprostol and methylergonavine are second-line or adjunctive agents. Tranexamic acid is a recent addition to the management of PPH, reducing bleeding and mortality. Uterine massage, fluids, and blood products are also indicated. Question 22. A patient in the ED is agitated and at risk of harming themselves. The CEN should use which type of restraint? Option A, physical restraint only. Option B, chemical restraint. Option C, physical or chemical restraint, as indicated. Option D, seclusion. The correct answer is option C. Physical or chemical restraint, as indicated. Restraints, physical or chemical, are used to protect the patient or others from harm. They should be used as a last resort when de-escalation has failed. Physical restraints include soft limb restraints, chemical restraints include medications, haloperidol, benzodiazepines. The CEN should monitor the patient closely and reassess for the need for restraint. Question 23. A patient presents with a panic attack, shortness of breath, chest tightness, and paresthesia. The CEN should: Option A, apply a paper bag to rebreathe CO2. Option B, provide reassurance and instruct the patient to take slow breaths. Option C, administer a benzodiazepine. Option D, perform an ECG. The correct answer is option D. Perform an ECG. Chest pain and shortness of breath in any patient should be evaluated for medical causes, ACS, PE. An ECG, vital signs, and appropriate labs should be done. While panic attacks are a common cause of hyperventilation, the CEN should not assume this without ruling out life-threatening conditions. If organic causes are ruled out, reassurance and breathing exercises are helpful. Question 24. A patient with a psychiatric emergency is being discharged. The CEN should: Option A, provide a written crisis plan and resources. Option B, schedule a follow-up appointment. Option C, ensure the patient has a safe discharge plan. Option D, all of the above. The correct answer is option D, all of the above. Psychiatric discharge planning is an essential part of emergency nursing care. It includes providing a written crisis plan, referral to community resources, scheduling follow-up appointments, and ensuring a safe home environment. This is part of the professional issues domain, covering discharge planning, patient safety, and continuity of care. Question 25. A patient with a migraine presents with a unilateral throbbing headache, nausea, photophobia, and phonophobia. What is the first-line treatment? Option A, triptan, sumatriptan. Option B, acetaminophen. Option C, morphine. Option D, metoclopramide. The correct answer is option A. Triptan, sumatriptan. Triptans, 5-HT1B/1D receptor agonists, are first-line agents for acute migraine, especially when the patient presents early. They are effective at aborting the headache. Acetaminophen and NSAIDs are for mild headaches. Metoclopramide is an antiemetic that may be given as an adjunct for nausea. Morphine is not recommended for migraine due to poor efficacy and risk of medication overuse headache.